Hello everyone, my name is Amber, Nicole, the other co-leader, and I will be going over the 3 pillars of therapy that protects the kidneys and also our strong, mighty heart. Before we get started, I will briefly go over what our heart and kidney does. First of all, the heart's job is to send a continuous supply of oxygenated blood around the body. Next, the kidney. Our kidneys filters the blood, extracting waste in the form of urine, and also helps regulate the water and salt levels to control blood pressure. Many studies are researching the clear relationship between kidney disease and heart disease. Having the heart disease can directly affect your chances of developing kidney disease, and vice versa. In fact, kidney disease and heart disease share many of the same risk factors, such as high blood pressure, high blood sugar, smoking, high cholesterol, poor diet, family history, obesity, and lack of physical activities. For example, having high blood pressure. Your heart will work harder to pump blood, which can strain the heart and your blood vessels, including the vessels in the kidneys, which can lead to kidney damage. These links between kidney disease and heart disease have led to a creation of the term cardiovascular kidney metabolic syndrome, CKM syndrome, which is a group of health conditions including heart disease, kidney disease, diabetes, and obesity. The renin-angiotensin system inhibitors. The RAS inhibitors represent a class of medications that function by antagonizing the actions of RAS. This group of medications includes ACE inhibitors, angiotensin-converting enzyme inhibitors, and angiotensin receptor blockers, ARBs. ACE inhibitors and ARBs both work by lowering the effects of angiotensin II in the body. When the blood pressure starts to go too low, the body starts making angiotensin II to help bring it up. ACE inhibitors slow down how much angiotensin the body makes, while the ARBs block the receptors that angiotensin II uses to narrow the blood vessels. So the common types of ACE inhibitors include benazepril, lisinopril, ramipril, whose brand names are Lutensin, Zestril, Altace, respectively. These medications are covered by the Ontario Drug Benefit, with some exceptions. Common types of ARBs include irbesartan, losartan, olmesartan, whose brand names are Avapro, Cozar, Benicar, respectively. These medications are also covered by the Ontario Drug Benefit, with some exceptions. Next, moving on to the trials, the first one we'll talk about is the ACE inhibitor. This is a trial conducted by Hu et al., which showed that benazepril therapy was associated with a 52% reduction in the levels of proteinuria and a 23% reduction in the rate of decline in renal function. In this study, Group 1 included individuals with serum creatine levels of 1.5 to 3.0 milligram per deciliter and received 20 milligrams of benazepril per day. Group 2 included individuals who had serum creatine levels of 3.1 to 5 milligrams per deciliter, also received 20 milligrams of benazepril per day. The other group is a placebo group. Next, I'll be talking about ARB trials conducted by Edmond and their colleagues. This study included participants who were hypertensive with nephropathy due to type 2 diabetes. They were assigned to either irbesartan 300 milligrams daily, amlodipine 10 milligrams daily, or placebo groups. So the results showed that the patients in irbesartan group had an unadjusted relative risk of reaching primary endpoint that was 20% lower than that in the placebo group. When they say primary endpoint, it means they have reached either doubling of baseline serum creatine concentration or the onset of end-stage renal disease or death. Additionally, the results showed that patients assigned to receive irbesartan had a rate of congestive heart failure needing hospitalization that was 23% lower than that among the patients assigned to receive placebo.
Aldosterone receptor blockers make up another class of medications that are protective of both your heart and kidneys. You may also hear them commonly referred to as mineralocorticoid receptor antagonists, or MRAs. Some common MRAs to know are spironolactone and finerenone. Finerenone is also known by its brand name Kerendia. These medications require a prescription and are also covered by the Ontario Drug Benefit, although some brands of spironolactone, such as aldactone, are only partially covered. So what do these medications do? As their class name suggests, both spironolactone and finerenone block the receptor of the hormone aldosterone, but they produce different effects. Spironolactone targets the kidneys and is a diuretic, or water pill. This means it prevents the kidneys from reabsorbing as much salt and water, making you produce more urine. With more water leaving your body, you have less blood volume and thus a lower blood pressure. Finarenone's actions, on the other hand, are more evenly distributed between the heart and kidneys. It blocks inflammation and fibrosis, or tissue scarring, in these organs, protecting them. We can turn to randomized control trials to speak to the protective effects of these medications on the kidneys. The RAILS trial was a major trial that compared spironolactone against placebo in patients with heart failure. They found a 30% reduction in all-cause mortality among those taking spironolactone, as shown in the graph, and this included lower risk in death from heart failure and sudden death from cardiovascular causes. They also reported 35% less hospitalizations for worsening heart failure, and notably, no significant increase in risk of renal failure. For finerenone, the Fidelio randomized control trial was conducted, which compared the drug against placebo in patients with both chronic kidney disease and type 2 diabetes. It was found that finerenone reduced outcomes such as kidney failure, declining eGFR, and death from renal causes, which can be seen on the graph in blue. The researchers also saw a reduction in cardiovascular outcomes such as cardiovascular death, heart attack, stroke, and hospitalization for heart failure. As can be seen from the results, both trials emphasize that these medications are not only good for protecting your kidneys, but they also protect your heart. The last group of medications we will discuss is the SGLT2 inhibitors, which are also commonly called gliflozins. Some common SGLT2 inhibitors to know are empagliflozin, canagliflozin, and dapagliflozin, whose brand names are Jardiance, Invokana, and Forxiga respectively. These are oral prescription medications which are covered by the Ontario Drug Benefit, except Forxiga, which is only partially covered. However, there are still other brands of dapagliflozin which the program does cover. So how do these medications work? As their name suggests, they block the SGLT2 receptor, which stands for sodium glucose cotransporter 2 receptor. This receptor is what allows sugar to be reabsorbed into the body within the kidneys, and blocking it causes the kidneys to pass sugar into the urine instead, removing it from the body. Hence, this medication lowers blood sugar levels in adults with type 2 diabetes, but it is also used to treat chronic kidney disease and heart failure in people with and without diabetes as well. There are several large randomized control trials that demonstrate the effectiveness of SGLT2 inhibitors. In 2019, the CREDENCE trial showed the benefits of canagliflozin for patients with diabetic kidney disease, followed by DAPA in 2020 and EMPA-KIDNEY in 2022, which extended the CREDENCE data into more populations, such as patients without diabetes and patients with other forms of kidney disease. These later trials also studied dapagliflozin and empagliflozin instead of canagliflozin. Ultimately, the trials showed that all three SGLT2 inhibitors benefit patients through fewer kidney outcomes, as can be seen in the blue lines on the graphs. Lastly, a collaborative meta-analysis completed in 2024 found a significant 37% reduction in kidney outcomes, such as kidney failure, death due to kidney failure, and declining eGFR when patients were on SGLT2 inhibitors. However, this was not all. The study also found significant benefits to heart health through reductions in major cardiovascular events, cardiovascular death, and hospitalized heart failure.
We hope that this video helped you understand more about medications for kidney diseases and heart diseases. Remember, this video is for informational purposes only and does not substitute professional medical advice. Always consult with your healthcare providers for personalized medical advice. Make sure to enjoy your week and stay healthy.